is done for the primary occlusion. Now we will have to talk about the characteristics of occlusion in the permanent dentition. Now, some of the characteristics in the permanent dentition are called anterior-posterior relations and facio-lingual relationships. Okay, we can have what we call, if I want only to state very rapidly the permanent occlusion, I will have to say that we can have an overlap of the maxillary, here in red, the maxillary teeth. They overlap the mandibular teeth, so they become more labially or buccally segments. This is a normal centric occlusion. Okay, this is the centric occlusion. So we can say that the first characteristics is this buccal overlap of the maxillary compared to the mandibular teeth. Number two, we have contacts. We will say how is the contact interarch in between the maxilla and the mandible. Also, with the exception of the maxillary third molars and the mandibular central incisors, with these two exceptions, always the upper meets the lower with two teeth on the opposite arch. Okay, in other words, each permanent tooth has two antagonist teeth. Okay, two opposing teeth in the mandible. This is called interarch contacts. We also may have some angulations. We will talk also about angles, the angulations of the permanent teeth. And we mean by angulation buccolingual and mesiodistal. How is the angle vertically? Normally, it is, or generally, vertically located in the alveolar bone, and we will talk about the angulations of the roots in the end of the lecture. We can talk also about the curvature of the arch. Also, it is put in the end of the lecture, which we have discussed the anterior-posterior curvature, the curve of Spee and the curve of Wilson. We have already discussed lately in the physiology as curvature, arch curvature. We have now to concentrate more on three types of relationship between the teeth, anterior-posteriorly. One called incisor relationship, canine relationship, and molars relationship. The incisor relationship, it is divided into three classes. The most normal is class 1. Class 2, when we say it is distal step, and class 3 is the mesial step. Now I will discuss more, okay, about class 1, class 2, class 3 relationships of each in the incisors, in the canine, and in the molars relationship. Usually, the incisor relationship, we have vertical overlap, and we say it's an overlap, overjet, or over horizontal or vertical, and now we will discuss it. But when we say about molar relationship, small relationship, it depends on the 6, okay, on the first, or on the maxillary first molar, and usually it is buccal to the mandibular first molar. We can have another from the buccolingual relationship. We can see the relationship of the premolars and the molars also. This is the incisor relationship. We have what we call a normal incisor relationship, have an overbite and overjet. We have class 1, class 2, class 3. We'll say about the overjet and the overbite, and a term called reverse overjet, because it is opposite to the normal overjet. This is the overjet and the overbite, the relationship between the incisor and the relationship between the maxillary central incisor and the mandibular central incisor. This is called a functional relationship between these both. Now, if we have it as horizontal and if we have it as vertical, let's say the vertical relationship between the lingual surfaces of the maxillary central incisor with the facial surface of the mandibular lower incisor, this is called the overbite, and it is a vertical relationship. Okay, now the second thing is called the overjet, and the overjet is the horizontal overlap. Overjet is the horizontal overlap in between the teeth. Both of these are called overlap. Okay, both of these are called overlapping of the maxilla. Because the maxilla is larger than the mandible, as a result, we'll have some overhang, and this overhang is either called overjet if it is lateral or anterior posterior. It is called an overjet. So we can say it is a horizontal overlap, or it is if we have a horizontal overlap, or if we have a vertical overlap, it is called, this is like here, it is called the overbite. Normally, it is difficult to correct these relationships, and we have, because we have normal, here we go. This is more illustrating on the same schema, the overbite vertically and the overjet horizontally. Now, if you want to classify it, it's classified either 0, this is the overjet, and this is the overbite. The overjet, which is the normal relationship on a horizontal plane, it might be either 0, none, or moderate, 2 to 4, or more than 4, which is called excessive overjet. Similarly, for the overbite, which is the vertical overlap, either it is moderate, 2 to 4, or slight, which means we have less contact in between the teeth. The facial surface of the lower central incisor only contacts a small surface of the upper central incisor. It doesn't go to the cingulum. This is the cingulum. Remember, this is the cingulum of the upper central incisor. It serves as a stop for the occlusion. Here we don't have enough stop. We don't have enough overbite, while here we have a sufficient overbite, or a moderate, we call it overbite. When we have the more than moderate, we call it a deep bite. This is a deep bite, and it is commonly present in the primary dentition. Okay, we have increased deep bites in the primary dentition. This is called deep bite because we have it is more than 4 millimeters, and it goes beyond the cingulum, the upper central incisor cingulum. Overjet, here sometimes we have it very high. It means that the maxilla overlaps the mandible with a significant horizontal overlap. Having talked about this overlapping in between the teeth, it affects, of course, it affects the teeth relationship, it affects the gingiva, it affects the periodontal tissue around the teeth. Okay, so mostly if we have very significant excessive, like here, or very deep bite, we will need surely to correct it, okay, to correct the difference. Canine relationship. Now we have also class 1, class 2, and class 3 canine relationships. If I tell you what is the case 1 and what is the class 2 and what is the class 3, as we have said about the, here you go, about class 1, class 2, and class 3 relationship, the class 1 of incisal stop, it means that, here we go, we have enough, this is an increased overjet. Okay, if we have enough overbite and overjet in between the maxillary central incisor and the mandibular central incisor, it is called class 1. Now, class 2, we will have increased overjet which means horizontally increased over jet, it is class 2. If we have edge to edge or decreased reverse, we call it reverse overbite, which is the horizontal overlap, we call it class 3. Either it would be no at all, no overbite at all, or it will no overjet at all, or it will be reverse, what we call it reverse overjet, and this is called a class 3 incisal relationship. Let's go to the canine relationship, where we have it's called canine guidance. We have class 1, class 2, and class 3. Now the class 1 canine relationship is when the canine, here you go, is found in between the occluded in between the mandibular lateral incisor and the mandibular canine. Okay, so the cusp of the canine occludes in between, and this is called a class 1 relationship, like here. Okay, like here it is called a class 1 relationship. Now if we have as we said, an increased, it means that we go distally, more distally to this in between. This is in between. Sorry that we don't have a. Here you go. I'll try to have a. Yes, here you go. So this is in between. But if we have it, this is the in between. This is in between. The mandibular lateral incisor and the mandibular canine. If we have it more distal, we will call it class 2, and if we have it more mesial, we would call it class 3. This is a class 3 canine relationship, while this is here a class 2 relationship. So this is a class 2 relationship, and this is a class 3 relationship. What did I say? Here you go. I guess it's here. Yeah, draw. Okay. So this is a class 2 canine relationship, and this is a class 3 canine relationship. Similarly, the molar occlusal relationship, to have finished it, and it is called in the permanent, it is called angles relationship. You'll hear about it a lot. Either it is a class 1, class 2, or class 3. Okay, now, yes, here we go. Okay. Now let's focus how is the molar occlusal relationship. Now if we have a here, if we have the mesiobuccal cusp of the maxillary first molar, it should occlude with the buccal groove between the mesial and the mesiobuccal and distobuccal cusp of the lower mandibular molar, first molar. Okay, this is the normal class 1 relationship. Now, if we have it more mesially located, if this mesiobuccal cusp is more mesially located than the normal, it was called class 2. And if we have it, this is class 2 relationship. And if we have it as distally, more distally located to this groove here, it would be called a class 3 angles relationship or class 3 molar relationship. Okay. So I hope for now, until now, it's clear. We have incisor, we have canine, we have a incisor relationship, which means we have overjet and overbite. We have also canine relationship, and we have molar relationship. Now, this is called an arch occlusal relationship, where we have the maximum intercuspation between the maxillary, if we have the occlusal, nice occlusal, or normal intercuspation between the maxilla and the mandible, we will have first the central incisors, maxillary and mandibular central incisors, labial aspect. This is the central incisors mesial aspect. So this is the relationship mesiodistally, and this is the relationship buccolingually, the facial. Okay. We have also the maxillary canine in contact with the mandibular canine and first premolar. We have also the maxillary first premolar, the maxillary 4, okay, the maxillary first premolar and the mandibular first premolar. Here it's called the buccal aspects of the maxillary and the mandibular. They meet like this as first premolars. Here we have maxillary first premolar and the mandibular first premolar in a mesial aspect. Also, these are the molar, and then we move to the molar. This is called a faciolingual relationship. So the molar, the first molars, this is the buccal aspect of them. This is the mesial aspect of the first molars, and this is the distal aspect of the first molars. Okay. This is a new one where we have, this is the primary dentition, where we said the terminal flush relationship, primary dentition, and this is the permanent dentition, and I put it together so that you remember the relationship between the primary and the occlusion of the primary and occlusion of the secondary molars. Now this is class 1 molar relationship. This is a class 2 molar relationship where it is more mesial, and this is a class 3 molar relationship where it is more the relationship between the upper and the lower molars. Finally, the curves of Wilson, the curves of Spee, and the curves of Spee, curve of Wilson, and the sphere of Monson. You have to read about it, and we have already taken it. Let me try to finalize here. In the final point here, the inclination and the angulation of the roots. Now the relationship of the the relationship of the angles of the roots in the maxillary and in the mandibular. We have single rooted teeth, we have bicuspids, and we have multi-rooted teeth, the upper molars, 3 rooted teeth, and we have the mandibular also molars. Okay, the angulations are different because we have the vertical relationship. Here you go, vertical angulation, and we have a dispersed distal angulation of the central incisors. Okay, this you will have to read from the book. I will give you the handout for the angulations of the roots. Mostly the mandibular arch is, as we know, it's wider than the maxillary arch. So the each tooth must be placed at an angle. So the maxillary is wider than the mandible. So the each tooth must be placed at an angle that can withstand the forces. This force relationship, it will make that if we have a tooth that is not placed in the normal angulation, the normal root angulation, it will be more at risk for mobility, and it cannot withstand the real forces as it should have a relationship with the alveolar bone. Okay, this is its relationship of the vertical axis with the alveolar bone in the mandible and the alveolar bone in the maxilla. Here it's the maxillary teeth, here it's the mandibular teeth. Normally, we don't have absolute rules, but normally each tooth must be placed at the angle that where we have good withstanding of the forces, and normally mesiodistally or faciolingually. Here is mesiodistal and here is faciolingual angles or inclinations of the teeth are described according to the long axis of the tooth and or perpendicular to the horizontal plane. Usually the axial inclination of the teeth, in general, they appear to be consistent, and we'll have it as a table. Okay. Antagonist. What does it mean, antagonist teeth? The arrangement of teeth, we said for the upper, each upper has a opposing lower, and we call it, of course, with the exception of the mandibular incisors, central incisors, and the maxillary third molars. We have said that loss of one tooth will keep the adjacent tooth in contact with the opposing antagonist. And if we have a mesial or distal drifting, especially after the loss of a tooth, we would have mesial or distal drifting for any cause, it will disturb the occlusal contact with the antagonist teeth. We'll have to say about centric stops. What does it mean, centric stops? You have it already, okay? When we have what we call supporting cusps and centric stops. At first, the lingual cusp tips of the maxillary posterior, maxillary molars, they make contact with the opposing fossa and with the opposing mesial marginal ridges of the mandibular molars, okay? Buccal cusp tips of the mandibular molars will make contact with the opposing fossa and opposing marginal ridges of the maxillary posterior teeth. This will make a what we call supporting cusps. If when the lingual cusps of the maxillary are opposing the buccal cusp of the mandibular, this is called a supporting cusp. What do we mean by supporting cusp, and what do we mean by centric stops? Centric stops is the area of the occlusal contact where we have the opposing teeth while they are in centric occlusion. We will have what we call a stop. Let me try to describe this for you. This is the normal molar relationship, okay, as we have described between the upper mesiobuccal cusp of the maxillary first molar and the lower or the mandibular first molar. This is number one. Number two, if we have, here is what we call a supporting stop or a centric stop. Here you go. Centric holding stop, we call it centric holding cusp or a supporting cusp, or sometimes we call it a stamp cusp. Here we have the lingual cusps of the maxillary posterior teeth, lingual cusps, and the buccal cusps of the mandibular posterior teeth. These are called supporting cusps, okay, functional cusps. Supporting cusps, they can be called also centric cusps because they occlude on the central fossa of each of the opposing teeth, the centric fossa and the marginal ridges. Here, this is the non-supporting cusp, or the guiding cusps are the buccal cusps of the maxillary posterior teeth and the lingual cusps of the mandibular molars. They are called non-supporting, and usually they guide the mandible, okay? They only guide it in lateral movements and not in centric occlusion, okay? Finally, this is what we call occlusal contacts. Occlusal contacts, if we have, this is a schema, this is the contacts that are presented. We have 138 points of contact, possible occlusal contacts, for the 32 teeth in general. And it is used in restorative dentistry and orthodontic dentistry. We have anterior contacts, occlusal contacts. See how it is in the mid buccolingual space of the maxillary teeth, while it is on the edge of the lower or of the mandibular centrals. or the mandibular anterior teeth, let's say. Okay, we can have also what we call cusp-fossa relationship, the relationship or the occlusion of the cusp, upper cusp with the lower fossa. And we can have something called cusp embrasure. This is given to you here. This is when you put the articulating paper that you have already learned about, the articulating paper, when you put it in between the maxilla and the mandible, you will have these 138 occlusal stops, okay, which are here. Now, movements of the centric occlusion, you can have either A or B or C. Also, this is after what we call occlusal fossa relationship or the occlusal embrasure relationship. We can either have upper 6 with the lower 6 working or non-working. Okay, so working side, non-working side, we can have balancing side in the complete dentures, and we can have guidance of teeth. We call it group function guidance or canine guidance. This is the lateral movement, only lateral movement, not eccentric occlusion, and you will learn about it next year. Also, we have what we call protrusive movement, which means the mandible goes beyond anteriorly, forward movement of the mandible. It's called protrusion. And here we can see the incisal guidance. We also have retrusive movement away from the centric occlusion, which is called retrusive movement. Not forward, backward of the mandible, backward movement of the mandible. All of these are called acentric occlusion. Lateral, protrusive, and retrusive are called acentric occlusion. Thank you for attendance, and I will stop this long lecture. We'll stop recording to receive questions.